Hi, Coach Todd here with Feel Good Life. In this video, I'm going to teach you 3 simple stretches you can do for patellofemoral pain syndrome. So PFPS, or patellofemoral pain syndrome, is really pain behind the kneecap, right? Patella is just a fancy word for kneecap. Femoral, or femur, which is your thigh bone, is where those two connect, and it's right behind that patella. And often it's caused because of a maltracking, or the tracking of your patella shifting over from one side to the next. And what happens is muscles around your knee start to atrophy, which just means shorten up and get tightened and just become unhealthy, and it pulls that patella out of alignment. And so stretching is really important because it helps loosen up that muscle and tendon tissue to help free up that kneecap so that you can move with more mobility and have that kneecap be more free flowing. So in this video, there's 3 really simple stretches that you can do to help free up that kneecap more. And if you're not part of our community, hey, just go ahead, hit that like and subscribe button. It would mean the world to us. Show us that you're enjoying these videos and you like to learn about how to live your life free from joint pain. But let's go ahead and get started with the 3 stretches for patellofemoral pain syndrome. All right, so first stretch is the quad stretch, or the quadricep stretch. I'm going to show you 2 different variations for this if the first one is more difficult. So you want to stand right next to a door or a wall, something that you can hold on to. I'm right next to this door and part of the wall. I'm going to grab my left ankle. So you bring your knee up high and grab your left ankle and pull it back. And so a couple tricks and tips for this one is you want to make sure your pelvis is tilted forward. So you don't want to tilt it back, and a lot of people have this anterior rotation of your pelvis, kind of your butt sticking out like this. You really want to tuck that pelvis in. So knee up as high as you can, grab that ankle and gently pull back. That can be hard, so I'm going to show you a modification that you can do for that one. But you want to pull back, and you're going to feel that stretch in your quad. Just like that. And you're going to hold it for 20 to 30 seconds. Again, my weight is on my right leg, pulling that left ankle back or up towards the butt. And it's really helping to stretch out that quad muscle. And sometimes parts of the quad start to tighten up, and it pulls that patella out of alignment and causes PFPS. Okay, so a lot of people 50, 60, 70 years old, they can't do that. They can't bring up their leg that high. So let me show you a modification that you can do. You're going to want to get a pillow or a rolled up towel. So I'm right next to a bed. This is next to our bed. This is actually our parents' cottage. We're traveling. We full time around the country, but we're staying here for a couple weeks. So what you can do is bring your knee up. So just like you were sitting, about to sit on the bed, but place best you can your ankle on that pillow, just like this. So you can see my thigh is almost in that same position. And then what you can do is kind of scooch forward. Now this is a lot of hip flexor stretch, the iliopsoas. But you're also going to be getting quad, and if you can, try your best to reach back for that ankle and stretch that quad. So you're just using the bed as a tool to help. Again, that pillow, and you could have more pillows or several rolled up towels, is just a way to prop up that ankle so that you can grab it easier than bring your knee up and then bringing it back that way. So try that modification for the quadricep stretch. But that's the first stretch that you can do for PFPS. All right, stretch number 2 for PFPS is the IT band stretch. So your IT band is just thick fascia that runs along your thigh, and what happens is, again, it starts to atrophy, from lack of use and just lack of mobility, staying stationary over decades, and it can help, or what it does is it can push that patella just slightly out of alignment. So we want to stretch that IT band out. So I'm right next to the wall, and I'm going to stretch out my right IT band. You can go ahead and do this along with me. So you're going to shift your weight to your right leg, then place your left foot over your right ankle or your right shin, and I'm holding onto the wall for balance. This is really important because you don't have a strong base like you do with 2 feet. Place that right foot over and just start pushing that right hip out, and you're going to feel that stretch run along. And if you are really struggling with balance, you can even lean against that wall a little bit. So this isn't a balance exercise where you're trying to focus on your balance. This is a stretch. So push that right hip out just like this. Hold it for 30 seconds. And you're going to feel that right along the side of your leg. Actually feels really good. And you don't need to keep your left foot right next to your right foot. You can place it out a little bit if you're struggling with your balance. This other foot is just used for support. It doesn't really have any weight in it. All right, after the 30 seconds are done, you can go ahead and shift to the other side. So left foot, right foot over, and press out. Press that left hip out to the side horizontally. There you go. You just want to feel that gentle stretch in your hip, and you can do that several times a day, but you want to hold it for at least 30 seconds. All right, stretch number 3 is the hamstring stretch. So your hamstring is the back part of your thigh, and again, that can also get tight and start to pull that patella out of alignment. So what you can do is, I like to do this right from a bed. So I just sit back into the bed, my foot and my knee is as straight as possible. You could even, use a pillow or rolled up towel to get that knee even straighter. But sit with an upright posture and slowly lean forward, just like that. And you're going to feel that stretch in the back of your hamstring. I'll move the pillow so you can see that a little bit better. But all I'm doing is leaning forward. I'd ideally want my heel onto the bed, but my right foot is off of the bed, my left foot is on the bed, and I'm just leaning forward. The knee doesn't need to be perfectly straight here. Now, of course, the straighter it is, the deeper stretch you're going to get. But if you're feeling a stretch with the knee slightly bent, that's okay. You're still targeting your hamstring. Just like that. You want to hold that again for 30 seconds. You don't want to roll. So a lot of people just try to reach their toes just like this and roll their shoulders and back forward. This isn't a shoulder exercise or a back exercise. This is, you're focusing on your hamstrings, right? So you just want to keep upright like this and just bend at the hip. That's the key, bending at the hip, and you're going to feel that right in the back of your thigh. And then, of course, you want to switch to the other side as well. All right, well, those were 3 stretches, actually 4 stretches that you can do for patellofemoral pain syndrome. Hold them for at least 30 seconds for each leg, each muscle, to really help to get that tissue to relax and to elongate. And what will happen over time is the muscles and the tendons, which connect the muscle to the bone, will help to release and to elongate and free up that patella so you can have better movement while you're walking upstairs or walking the dog or walking with your spouse, walking on the beach, whatever you're doing, you're gonna have greater movement and freedom in your patella. So hopefully that's helpful for you. Again, a reminder, hit that like and subscribe button. It would mean the world to us. If you guys have any comments, we'd love to hear from you. If you have questions, just post them right underneath this video. And I'm Coach Todd with Feel Good Life, and love to hear from you guys, and love to continue to help you on your journey towards greater joint pain. So I'll see you guys in the next video.